Hi, my name is McMaster. I will be doing wound culture. First, I will do hand hygiene before I enter in the room, and then I will introduce myself. I will check the patient band for name, date of birth, and medical record. I will then close the door or shut the curtains and make sure the patient has full privacy. I will gather my supplies, and before I start, I will explain to the patient what we'll be doing and how we will be doing it. First, I will begin with hand hygiene. I will grab my sterile gloves. I will open the package sterilely. Make sure I have nothing near me to contaminate. I will open my gloves. I will then open my sterile swabs. Next, I will look over the wound, see if there's any dressing that needs to be taken off, if there's any crusted pus or anything that should be cleaned before I take my culture. Once I do that, I will then don my gloves. Next, I will take one of my swabs and do the outside of the wound, get any excrete out. Then usually it comes with a tube that you would put this in and it would snap off and then you could tie it up. So I'd put that in its tube. And then I would grab another swab sterilely, of course, and I would go inside. This way I can make sure I get anaerobic and aerobic cultures, depending on what the doctor ordered. Then I would do the same thing. I would put this in the tube, crack it, close the lid, and then that. And then for both of the tubes, I would put a patient label. I would probably sign and date and the time. And then I would send those to the lab. And then I would make sure that I would document everything that I did in the patient's chart and the time that I sent the specimen to the lab.